Hello everyone, myself Dr. Neha. In this video, I am going to discuss about the anatomy of ureter and urinary bladder. The ureters, these are the muscular tube transporting the urine from kidney to urinary bladder. The length varies from 20 to 30 centimeters and the width is 2 to 4 millimeters. The beginning of ureters is in the form of renal pelvis. So this is the course of the ureter. They begin within the renal sinus as renal pelvis. The ureter passes downwards and slightly medially on the psoas muscle as we can see in the diagram. Then they enters the pelvis by crossing the front of termination of common iliac artery. In the diagram we can see the termination of common iliac artery. So they are crossing the anterior side of the bifurcation of common iliac artery. After entering the pelvis, it reaches the base of the bladder and then enters into the bladder wall obliquely and open into the lateral angle of the trigone. Now the parts of ureter. Ureter possess three parts. First is the pelvis of ureter, second abdominal part, and the third is pelvic part of ureter. Now the pelvis of ureter. It is a funnel-shaped dilatation at the upper part which is formed by the union of major calyces. It passes downwards and medially through the hilum. The capacity of pelvis of ureter varies from 5 to 7 ml. In the diagram we can see the red colored area. This is the pelvis of ureter. Then the abdominal part. It passes downwards and medially by passing beneath the peritoneum and enters the pelvic cavity by crossing the termination of common iliac artery. Now the relations of the abdominal part of the right ureter. On the anterior side, as we can see in the diagram, it is related to the parietal peritoneum, right gonadal vessels, second and third part of duodenum, right colic and ileocolic branches of superior mesenteric vessels, root of mesentery, and terminal part of ileum. This right ureter posteriorly related to the psoas major muscle and its covering fascia, genitofemoral nerve, and the tips of the transverse processes of the lumbar vertebrae. Here we can see the anterior relation of the right ureter as well as left ureter. In this diagram we can see the peritoneum and various vessels on the anterior aspect. Now the anterior relations of the left ureter, the parietal peritoneum, left gonadal vessels, left colic and sigmoidal branches of inferior mesenteric vessel, sigmoid mesocolon and terminal part of ileum. The posterior relations are same for the left ureter as well. So these are the posterior relations of the ureter. That is, we can see the psoas major muscle. In front of it we have the genitofemoral nerve over here, and this psoas major muscle arises from the transverse process of the lumbar vertebrae. So these structures are related on the posterior aspect of the ureters. Then the pelvic part. The pelvic part, it runs downwards beneath the peritoneum along greater sciatic notch and reaches the ischial spine. In the pelvis, ureter possesses three parts. The first part of ureter is from bifurcation of the common iliac artery up to the ischial spine. In the diagram above we can see the first part of pelvic part of ureter. The relations on the anterior side, these are covered by peritoneum. In female it possesses the ovarian fossa. On the anterior side of the ureter we can see this is the ovarian fossa containing the ovary and the fallopian tube. On the posterior side we can see the internal iliac vessels, lumbosacral trunk and sacroiliac joint. Medially it is related to the peritoneum, and on the lateral side we can see the obliterated umbilical artery, the obturator nerves and vessels, inferior vesicle, middle rectal artery, uterine and vaginal arteries in case of females. Now the second part or oblique part of ureter in the pelvis, it is that part which is from ischial spine up to the bladder. For this, the ureter runs forwards and medially through the extraperitoneal tissue and reaches the superolateral angle of the bladder 5 cm from opposite ureter. Here it is related below and laterally to the levator ani muscle and its fascia. As we can see in the diagram, this is the levator ani muscle and its fascia, and above and medial it is related to the peritoneum. Then in case of males, above and medially it is crossed by the vas deferens, as we can see in the diagram. This is the vas deferens, and below it is related to the seminal vesicle. In female, it is related above with the lower margin of the broad ligament of uterus and the uterine artery. Below it is related to the McInrod's ligament and lateral fornix of the vagina. Also levator ani muscle, and medially it is related to the supravaginal part of cervix. Then the third part of pelvic part of ureter is the intravesical part, that is the part which is lying inside the musculature of the urinary bladder. It pierces the musculature of the bladder and undergoes oblique course downwards and medially through the bladder and opens into the interior of the bladder. Now the normal constrictions of ureter. So there are 5 constrictions in the ureter. First lies at the pelvic-ureteric junction, that is at the junction of pelvis of ureter and the ureter proper. The second lies at the pelvic brim or at the place where it is crossed by the common iliac artery. The third lies at the level of vas deferens, where the vas deferens crosses the ureter. In case of female, it is crossed by the broad ligament of uterus. Then at the passage through the bladder wall, here lies the fourth constriction, and the fifth constriction lies at the ureteric orifice, that is opening of the ureter at the lateral angle of the trigone. Now the factors which are preventing the reflux of urine. The oblique direction of the intravesical part of ureter, this prevents the reflux of urine. Also, peristalsis of ureteral muscles at 2 to 5 times per minute. Urine is collected in bladder in jets and not continuous. The reflux from lower part to the upper part of the ureter is also prevented by the first constriction of the pelvic ureter junction, which is narrow. Now the nerve supply. The ureter is supplied by the sympathetic nerve fibers coming from T10 to L1 spinal nerve. Also, the parasympathetic nerve fibers, that is from S2, S3, S4 spinal nerves, supplies the ureter. Now the blood supply. It is supplied by in the upper part by renal artery, in the middle part from the aorta, in the pelvic part it is supplied by the vesical artery, middle rectal and uterine vessels. Now some clinical aspects. The ureter is readily identified in life by its thick muscular wall, which is seen to undergo worm-like or vermicular writhing movements, particularly when gently stroked or squeezed. The ureter is relatively narrow at 3 sides: at the junction of the pelvis of ureter with its abdominal part, at its pelvic brim, and at the ureteric orifice, which is the narrowest. The ureteric calculus is likely to lodge at one of these levels. If we take the X-ray of abdomen, in this, in search of ureteric stone, the ureteric stone may be found at 3 places, that is in front of the transverse processes of the lumbar vertebrae, in front of the sacroiliac joint, and in front of the ischial spine. Now ureteric colic. It is the intense colic pain which is starting from loin, goes up to the groin. So this is the pain which is caused by ureteric stone. So this is the pain of ureteric colic. Ureterocele. It is a congenital anomaly. In this, there is a swelling at the lower end of the ureter, causing difficulty in passage of urine. Then we have golf hole ureter. Normally, ureteric orifice presents oblique slits. Sometimes one orifice is circular in shape. due to shortening of the ureter as observed in the tuberculosis of the kidney. Then the duplex ureter. When there is presence of double ureters, this is termed as duplex ureter. So this completes the topic of the ureter. In the next video, I will be coming up with the anatomy of urinary bladder. Thank you.